Hi, I am Dr. Pradeep Kumar N. I am a consultant plastic surgeon in Bangalore. A person affected with facial palsy will have an asymptomatic smile. When smiling, one side of the face moves but the other side doesn't move. He may have drooling in the face where constant salivary dribbling might happen. There will be dumping of the food in one side of the jaw. He'll not be able to swallow it fully. And coming to the eyes, he is not able to close the eyes fully. This may lead to conjunctivitis and repeated tear discharge. These tears will keep on flowing and this becomes a nuisance for the patient to work in the environment. He cannot go out, he cannot communicate. His confidence level reduces a lot. For this, patient sorts to use masks and spectacles, which becomes a boredom for him. With reconstructive surgery, we can solve all his problems. We can try to create a smile. We can try to reduce the dumping of the food. We can make the eyes close fully, reduce the tears. We can bring the patient back to his self-esteem and back to his normal life.